welcome back to my channel. And if you are visiting this space for the first time, you are also highly welcome. In this lecture, we'll be looking at the internal iliac artery. Let's try and use this image by the side to describe where the internal iliac artery is located. This structure that is arrowed here in red is the abdominal aorta. We know that abdominal aorta at its inferior end will finally terminate into the common iliac artery. So you have the abdominal aorta at this point that tallies with the level where we have the fourth lumbar vertebra terminating or finally dividing into the common iliac artery. This is where we have common iliac artery here arrowed in black. We have two. We have one on this side and we have the other one on the other side. So you have the common iliac artery finally, descending laterally downwards. And at this inferior region, you see the common iliac artery also finally terminating into the internal iliac artery that is highlighted here in green. So the external iliac artery that is highlighted here in blue. So you have the internal iliac artery here and you have the external iliac artery on the other side. This lecture will be focusing on the internal iliac artery. So let's go through this lecture video where we'll be highlighting the different branches of the internal iliac artery and also the different organs or viscera that they supply. So the internal iliac artery is an emergence from the common iliac artery. We already described this in our previous slide. Using this image here by the side, this is where we have the common iliac artery. We say that the common iliac artery is an emergence from the abdominal aorta. I have put up a lecture on the common iliac artery. If you check up that lecture, please kindly go and do so. This common iliac artery, after its emergence from the abdominal aorta, we further descend laterally downwards. And at this point, that tallies with the sacroiliac joint. This is where we have the sacroiliac joint here, arrowed in purple. Also at this point, we have the alignment of the pelvic brim or the pelvic inlet. And this is what is seen to be highlighted here in dotted yellow. If you go through our lecture on the pelvic inlet, we highlighted in that lecture that the posterior end of the pelvic inlet is seen to also align with the sacral promontory. And this is where we have the sacral promontory here, arrowed in green. So if you take all these points together, you can use this to stage the point where we have the bifurcation of the common iliac artery. So at this point, we have the bifurcation also of the common iliac artery into the internal iliac artery that is highlighted here, and also the external iliac artery that is highlighted on the other side. So you see that common iliac artery, the name common means that there is further emergence from this artery. So this common means that it is common to both the internal and the external iliac artery. So at this terminal end of the common iliac artery, we also have further emergence of the internal iliac artery and also the external iliac artery. And if you try to compare the caliber of these two arteries, you see that the external iliac artery is larger in terms of caliber than the internal iliac artery. So we can say that the internal iliac artery is a smaller terminal emergence of the common iliac artery. This internal iliac artery will be seen to be contained within the lesser pelvis or the true pelvis. Because if you look at how it emerges, we say that the common iliac artery will drive down to the point where we have the pelvic brim or the pelvic inlet. And we know that the pelvic brim or the pelvic inlet is what demarcates the greater pelvis from the lesser pelvis. Inferior to the pelvic brim or the pelvic inlet is where we have the lesser pelvis or the true pelvis. So if you look at how it emerges around the region where we have the alignment of the pelvic brim or the pelvic inlet, you see that the internal iliac artery will be positioned within the lesser pelvis. So this is a point that we should take note of in case we are asked during examination. The internal iliac artery is seen to be contained within the lesser pelvis, because if you drive back to how it emerges, we say that it emerges from the terminal end of the common iliac artery. And this common iliac artery is seen to drive down to the point where we have the alignment of the pelvic brim. So if it emerges, it means the internal iliac artery will be contained within the lesser pelvis or the true pelvis. So you see it traveling down laterally, and you see it running along the lateral wall of the pelvic cavity, directed to the point where we have the greater sciatic foramen. At this point, you now see that the internal iliac artery will also further subdivide. You can see that there are subdivision in terms of sequence. The initial subdivision that we have is from the abdominal aorta, where its inferior end is seen to terminate into the common iliac artery. After which, we also have the common iliac artery also terminating at its inferior end into the internal and the external iliac artery. This internal iliac artery is also seen to also finally terminate into two trunks. So we have the emergence of the anterior and the posterior trunk. The branches of the internal iliac artery will emerge from the anterior and the posterior trunk, but there is an initial division of the internal iliac artery into the anterior and the posterior trunk before we then have the final emergence of its branches. So we see that the internal iliac artery will initially divide into the anterior trunk and also the posterior trunk. So if you look at this image by this side, this is where we say we have the internal iliac artery that is contained within the true or the lesser pelvis. So within this region, it's seen to descend inferiorly to the point where we have the greater sciatic foramen. And at this point, you see it finally dividing into the anterior trunk at the front and also the posterior trunk behind. So you see that there is an initial division into anterior and posterior trunks. The branches will then further emerge from these two trunks. So in totality, we have 10 branches from the internal iliac artery. But before these branches would emerge, we say that the internal iliac artery will initially divide into the anterior trunk and also the posterior trunk. So we have the anterior trunk giving off 7 branches. We have the posterior trunk then giving off 3 branches. So if you sum it up, you see that in totality, we have 10 branches. So these 10 branches will be highlighting in a subsequent slide, but it is good for us to establish the fact that we would have an initial division into trunks. And when you hear trunks in anatomy, you see that there's going to be further emergence. So it means that this division will produce the branches that we would be highlighting. But it's good for us to have this fact. Most of these branches will be seen to give off branches to supply viscera or organs that are located within the lesser pelvis or the true pelvis. While some of these branches will be seen to exit the pelvic cavity, while also some of these branches will be seen to exit the pelvic cavity, but will be seen to give off branches within the pelvic cavity. So it's good for us to take note of this. So by the time we start highlighting the branches and of course describing the pattern or the orientation, you would see that most of these branches are seen to provide supply for the viscera that are located within the true pelvis or the lesser pelvis, while some will be seen to exit the pelvic cavity. And this is where they'll be supplying regions outside that space. Well, of course, a number of these branches also will be seen to exit the pelvic cavity, but of course will be seen also to give off branches within the pelvic cavity. So this is an interesting pattern that we should be looking forward to unfolding. So let's go through the subsequent slides where we'll be highlighting the different branches that would emerge from the internal iliac artery. But at the back of our mind, we would be working based on the initial establishment that we have of the anterior and the posterior trunks. So let's drive through the posterior trunk. We say that the posterior trunk is seen as a posterior emergence of the internal iliac artery. This is the initial subdivision of the internal iliac artery. We already described this in our previous slide. Why this will be giving off 3 branches. So we have 3 branches from the internal iliac artery, but specifically will be emerging from the posterior trunk of the internal iliac artery. So the first branch that we would have from the posterior trunk is the iliolumbar artery. If you go back to this image here, this is where we have the posterior trunk here highlighted in yellow. This is the posterior trunk, of course, the posterior emergence from the internal iliac artery. If you look at this other hand here on this other side, we have the posterior trunk here also highlighted here in yellow, while we have the anterior trunk here in the other side, of course, in the anterior region. But if you go back to this other side, we see that the anterior trunk here is removed. This is to give a clear presentation of how these branches would emerge from the posterior trunk. So we try to take up the anterior trunk here at this region. So this is where we have the posterior trunk here here, highlighted in yellow, and say that the first branch that would emerge is the iliolumbar artery. So this is where we have the iliolumbar artery here, highlighted in dotted blue. Iliolumbar artery is seen to emerge from the posterior trunk of the internal iliac artery. And after its emergence, you see it ascending upward. If you look at the name of this artery, iliolumbar, lumbar is at the upper part. The ilium also is positioned at the upper part. So you should expect that after its emergence, it should be driven upward. So this artery is seen to further subdivide into the iliac branch and also the lumbar branch. So you have the iliac branch here, of course, supplying the iliacus muscle, while we have the lumbar branch ascending to supply the psoas major muscle and also the quadratus lumborum. So you see that at this point, we have final subdivision of the iliolumbar artery. If you drive through the name of the iliolumbar artery, you see that it has the iliac and also the lumbar branches. So these are the two branches that would emerge from the iliolumbar artery, and of course are seen to supply different structures. So you see that they emerge and are seen to supply structures outside the true pelvis. So this is one of the vessels that we tried to describe in our previous slide. Then the second emergence is the lateral sacral artery. This is the lateral sacral artery here, highlighted in dotted green. The lateral sacral artery is seen to also emerge from the posterior trunk of the internal iliac artery. And after its emergence, you see it running along the lateral border of the sacrum. You see it giving off superior and inferior branches. It's seen to drive into the sacral foramina. It is also seen to provide supply for muscles around the sacral region. So you see that this lateral sacral artery is providing supply for structures that are located around the pelvic cavity. Also, you see that this lateral sacral artery finally will form an anastomosis with the median sacral artery. Remember, we tried to describe our median sacral artery in our previous lecture on the common iliac artery. This median sacral artery is seen as a posterior emergence of the abdominal aorta, just around the region where you have it bifurcated into the two common iliac arteries. So you have the lateral sacral artery also forming an anastomosis with the median sacral artery. So this is the second emergence from the posterior trunk. And the next emergence, which of course is the last emergence from the posterior trunk, is the superior gluteal artery. This superior gluteal artery, from the name, you see that it will be providing supply for the gluteal region. So you see it emerging from this region here that is highlighted at this point. But one distinct feature or characteristics that the superior gluteal artery presents is that they are seen to run superiorly above the piriformis muscle. If you try to use this image by the side here, let's say this is where we have the piriformis here, highlighted here in black. The piriformis muscle is seen to emerge from the anterior lateral surface of the sacrum, and you see it finally driving through the greater sciatic foramen. This is how it exits the pelvic cavity and finally is inserted on the greater trochanter of the femur. So you see it passing through this following course in the quest of finally being inserted on the greater trochanter. So after the emergence of the superior gluteal artery from the posterior trunk of the internal iliac artery, you see it parting above the piriformis, and it is supposed to part above it because it is a superior gluteal artery. And this is where the name is being drafted from. So after it parting above the piriformis muscle, it is now seen to exit the pelvic cavity through the greater sciatic foramen. Remember that the piriformis also will exit the pelvic cavity through the greater sciatic foramen. So it follows with the piriformis muscle also in that alignment. But while the piriformis is exiting the pelvic cavity through the greater sciatic foramen and also driving to be inserted on the greater trochanter of the femur, the superior gluteal artery is also following superiorly. It's also seen to part above the piriformis through the greater sciatic foramen, but it is seen to be driven posteriorly, where it will be providing supply for the structures that are located in the gluteal region. You can see the dramatic presentation of the superior gluteal artery, of course, in relation to how it runs along with the piriformis. So this is what is seen to be exhibited around this point. So if you try to use this lower image to further illustrate how the superior gluteal artery also runs. So if you try to use this image here, this is where we have the piriformis here, arrowed in blue. So the piriformis is seen to emerge from the anterior lateral surface of the sacrum here, and you see it directed through the greater sciatic foramen. It is through this foramen that it exits the pelvic cavity, and you see its fibers inserted on the greater truncata of the femur. So this alignment is created by the piriformis. So after we have the emergence of the superior gluteal artery from the posterior trunk of the internal iliac artery, you see it being directed here above the piriformis. And this is what is seen to be highlighted here in black. So it is directed, of course, crossing or parting above the piriformis. And this is why it is termed the superior gluteal artery. And it's gluteal because it's supplying the gluteal region. You see it then running through the greater sciatic foramen. From the greater sciatic foramen, it is seen to be directed backwards, where it will be supplying the gluteal region. So this is how the superior gluteal artery would run in the aim of accessing the posterior gluteal region. So these are the three branches that would emerge from the posterior trunk of the internal iliac artery. We have the iliolumbar branch, we have the lateral sacral branch, and finally we have the superior gluteal branch. So these branches are the subsequent branches that would emerge from the posterior trunk. So let's drive further on the anterior trunk. So we say that the anterior trunk will produce 7 branches. And if you try to use this image here, this is where we have the anterior trunk here, arrowed at this point. We already described the branches from the posterior trunk. So from the anterior trunk, the first branch that we would have is the umbilical artery. And this is where we have the umbilical artery here, highlighted in blue. The umbilical artery is a functional artery during the development of form. And after birth, when the umbilical cord is cut off, this umbilical artery will become obliterated. But before then, there's going to be the emergence of a functional branch from the umbilical artery. And this is the superior vesical artery. This is where we have the superior vesical artery here, highlighted here in dotted red, as an emergence from the umbilical artery. This superior vesical artery will supply the upper region of the urinary bladder. Vesical means urinary bladder, and superior means above. So it means this superior vesical artery will be giving supply to the superior region of the urinary bladder. And we know that the urinary bladder is one of the viscerals located within the pelvic cavity. After the final emergence of the superior vesical artery, you see it ascending up along the midline plane, where it will finally become obliterated, and it will be transformed into the median umbilical ligament. But before this occurrence, there's going to be the emergence of the superior vesical artery that will be seen to provide supply for the upper region of the urinary bladder. The second branch that would have is the obliterator artery. This is the emergence of the obliterator artery here, highlighted in red. The obliterator artery also presents a dramatic part in terms of how it runs. This artery is also seen to finally exit the pelvic cavity. So let's see how it exits the pelvic cavity. So after the emergence of the obliterator artery from the anterior trunk of the internal iliac artery, you see that this artery is directed towards the obliterator canal. This is where we have the obliterator foramen. The obliterator foramen is what is further transformed into the obliterator canal. And this is done by the obliterator membrane. So we have the obliterator membrane here highlighted at this point. So you see that this obliterator membrane is seen to cover incompletely the obliterator foramen. And because of this incomplete presentation, it is seen to leave a space around this region. And this is what is referred to as the obliterator canal. I've also put up a lecture on this dramatic event around the obliterator foramen. You can go and check up that video. So you have this space left because of the incomplete covering of the obliterator foramen. And this space that is left here is called the obliterator canal. This obliterator canal is what allows the exit of the obliterator artery. So you can see that this space is not left for fun. It is left for a purpose. So we have this opening created so that the obliterator artery, after its emergence from the anterior trunk of the internal iliac artery, we have a space to exit the pelvic cavity. And this is how it parts to exit this point, the obliterator canal. And this is where it finally goes and gives supply to muscles that are located in the medial compartment of the thigh. So you see that the obliterator artery is seen to run this course. But before it exits the obliterator canal, this obliterator artery is seen to give off 2 branches. So it gives us the pubic branch, and this is where we have the pubic branch here, highlighted here in dotted blue. So before its final exit through the obliterator canal, it gives off this branch. And this branch is what is referred to as the pubic branch. This pubic branch is seen to form an anastomosis with the inferior epigastric artery. So we have the inferior epigastric artery here at this point. The inferior epigastric artery is an emergence from the external iliac artery. When we put up a lecture on the external iliac artery, we would be highlighting this vessel. So you have the emergence of the inferior epigastric artery. This inferior epigastric artery will also be giving off its pubic branch. And at this point here, there's going to be the creation of anastomosis between these two vessels. So you see that the pubic branch from the obliterator artery and also the pubic branch from the inferior epigastric artery will unite to form anastomosis. And at this point, we have the creation of anastomosis that is referred to as the corona mortis. This corona mortis is also referred to as the crown of death. It is referred to as the crown of death because it is an important area during the process of surgery around this region. Because any injury or damage that is infringed on this anastomosis will lead to profuse bleeding. So this anastomosis can create profuse bleeding if lacerated. So you see that we have the emergence from the obliterator artery that is creating anastomosis with another branch from the external iliac artery. We also have the second branch that is referred to as the acetabular branch. This is where we have the acetabular branch, also highlighted here in dotted blue. This acetabular branch is seen to be driven or directed towards the acetabulum. And this is where it is seen to provide oxygen and nutrients for structures that are seen within the region of the acetabulum. So you see that before the obliterator artery finally exits the pelvic cavity through the obliterator canal, it is seen to give off two branches. And we've tried to highlight these two branches. Then going through the anterior branches, remember we said that we have 7 branches emerging from the anterior trunk. In our previous slide, we tried to describe 2 of those branches. So let's try and use this image. This is where we say we have the anterior trunk that is harrowed here in blue. So we have another group of branches that would emerge from the anterior trunk. The first one is the inferior vesical artery. This inferior vesical artery is what is seen to be harrowed here at this point. We say vesical means urinary bladder. Remember previously we described the superior vesical artery which emerges from the umbilical artery. We say that this artery supplies the superior region of the urinary bladder, which means the inferior region needs to be supplied by another vessel, and this is what will be supplying that region. So we have the inferior vesical artery supplying the inferior region of the urinary bladder. It is also seen to supply the prostate gland and also the seminal vesicle. In female, there is a female version of this vessel, and this is referred to as the vaginal artery. So you see that the vaginal artery is what is seen in female, and it's seen to supply the inferior region of the urinary bladder. It is also seen to supply the walls of the vagina, while in male, we have the inferior vesical artery. Then we have the uterine artery. This is the uterine artery here, arrowed in yellow. The uterine artery is also seen as an emergence from the anterior trunk of the internal iliac artery, and it is seen to supply the uterus. This uterine artery finally is seen to create anastomosis with the ovarian artery. And we know that the ovarian artery is a branch from the abdominal aorta. So you have anastomosis created along the wall of the mesentery. So you have the uterine artery also emerging and giving supply to the uterus. Then we also have the middle rectal artery. This is where we have the middle rectal artery, also a branch from the anterior trunk of the internal iliac artery. And this is what is seen to be harrowed here in black. Middle rectal is seen to supply the inferior region of the rectum. The superior region of the rectum is seen to be supplied by the superior rectal artery, which of course is the branch from the inferior mesenteric artery. So you have the middle rectal artery emerging as a direct branch from the anterior trunk of the internal iliac artery. We also have an inferior rectal artery that will be emerging from the internal pudendal artery. We'll be highlighting this artery when we get to that point. So in addition to the 2 branches that we have, which include the umbilical artery, the obliterator artery, we also have the inferior vesical artery, the uterine artery, and also the middle rectal artery. So let's go to the last 2 branches that we would have, from the anterior trunk of the internal iliac artery. So using this image again here, this is where we have the anterior trunk. So it's good for us to align our thought, of course, knowing where the anterior trunk is located. So this is where we have the anterior trunk here, heralded in black. And one of the remaining branches is the inferior gluteal artery. This is where we have the emergence of the inferior gluteal artery here. If you look at this structure that is highlighted here in yellow, this is where we have the piriformis. Remember, we tried to describe the piriformis when we tried to highlight the superior gluteal artery. We said that the superior gluteal artery is seen to part above the piriformis. The inferior gluteal artery is seen to part below the piriformis. And this is where it is so referred to as the inferior gluteal artery. This inferior gluteal artery also is seen to part below the piriformis and also seen to pass through the greater sciatic foramen. And this is where it's finally seen to exit the pelvic cavity and, of course, driven posteriorly where it will be supplying the gluteal region. So if you try to use this image here, this is where we have the inferior gluteal artery. And of course, you see it parting below the piriformis. Remember, the superior gluteal artery is seen to part above the piriformis. It's one of the branches from the posterior trunk of the internal iliac artery, while the inferior gluteal artery is a branch from the anterior trunk of the internal iliac artery. So you see it being directed inferior to the piriformis, of course, accessing the greater sciatic foramen, where it will finally exit the pelvic cavity. And now this region is directed posteriorly to supply structures that are located in the gluteal region. So you have this dramatic occurrence also presented by the inferior gluteal artery, just as what we have in the superior gluteal artery. The only difference is that the superior will part above, while the inferior will part below. Then the last branch is the internal pudendal artery. This internal pudendal artery is the final emergence of the anterior trunk of the internal iliac artery. And this is where we have the internal pudendal artery. This internal pudendal artery is seen to also exit the pelvic cavity through the greater sciatic foramen. And it is seen to re-enter back through the lesser sciatic foramen. So you see it exiting it above and, of course, coming in back at the inferior region, of course, through the lesser sciatic foramen. As it enters into the pelvic, it is seen to be directed into the pudendal canal. Remember, the pudendal canal is located at the lateral region of the anal triangle. We described this in our lecture on the anal triangle. So you have this pudendal canal. It's so named the pudendal canal because it is within this canal that we have the pudendal vessel. So you have this artery, of course, coursing through the pudendal canal. And of course, it's seen also to give off a number of branches. We have the inferior rectal artery. The inferior rectal artery is the first emergence from the internal pudendal artery, and it is seen to supply the inferior region of the rectum. Remember, we described our middle rectal artery in our previous slide, which of course is the direct emergence from the anterior trunk of the internal iliac artery. While the inferior rectal artery is not a direct emergence, but of course it emerges from the internal pudendal, which of course is a direct emergence from the anterior trunk. So this is how this artery is, of course, emerges. So we have the inferior rectal artery supplying the inferior third of the rectum. Then the next vessel we have is the perineal artery. The perineal artery is seen to further subdivide into the posterior scrotal or the posterior labial artery. Then we have the transverse perineal artery also emerging from the perineal artery. Then the next branch is the artery to the bulb of the penis or artery to the bulb of the vestibule. Then we have the urethral artery that supplies the urethra. Then we have the deep artery of the penis or the deep artery of the clitoris. Then finally, we have the dorsal artery of the penis or the dorsal artery of the clitoris. So it depends. If it is in the male, it will be penis. If it is the female, it will be clitoris. So let's try and put up this image up here. This is where we have the internal pudendal artery. Of course, after its emergence from the anterior trunk of the internal iliac artery. We said that it exits the pelvic cavity and also re-enters back. So giving off its number of branches that we have highlighted, we first have the inferior rectal artery. And if you look at the inferior rectal artery, we say it supplies the rectum. We know that the rectum is located within the posterior region of the perineum. So if you go more anteriorly, the next emergence you have is the perineal artery. This perineal artery further subdivides into the posterior scrotal artery or the posterior labial artery. Then you have the transverse perineal artery. So you see that the scrotum, of course, is located at the posterior region. Then if you go more anteriorly, you then have the root of the penis. And this is why we have the emergence of the artery of the bulb of the penis. So you see that as these branches are emerging, it's also following the alignment of the structures that are located along that path. So the next artery you have is the urethral artery. This urethral artery is a very short artery, and you see it's supplying the wall of the urethra. And we know that the urethra, of course, will emerge from the root of the penis. Then the next one is the deep artery of the penis, or the deep artery of the clitoris. Then finally, you see it terminating to supply the posterior region of the penis, or the posterior region of the clitoris. And this is where we have the emergence of the dorsal artery of the penis, or the dorsal artery of the clitoris. You see that as the internal pudendal artery is moving forward, it is giving off branches to supply organs or structures that are located along its paths. So this is the presentation that we have. So now in totality, we have 7 branches from the anterior trunk, while we have 3 branches from the posterior trunk. And it's good for us to be able to highlight how they emerge, the path that they run, and also the different structures that they supply. All in all the 10 emergents are now seen to supply different structures within the pelvic cavity, while some are seen to exit the pelvic cavity to supply structures around that space. So thanks for watching this video. Let's continue to stay glued to this channel.